Hello, everybody. This is Dr. Kamel again. If you didn't listen to any of my videos before, my name is Dr. Kamel. I work as Associate Professor of Physical Therapy, and I'm a licensed registered physical therapist in the United States, in the UK, in Egypt. I got my PhD from University of Nottingham in the UK. So my content is mainly about the preparation for physical therapy license exam. In fact, I am running a course for preparation for the license exam for people who are interested in taking these exams either in United States, in Canada, and in Australia mainly. So let's go and see what is the content for today. A patient with muscular dystrophy was removed from mechanical ventilation 1 day ago. The patient is currently unable to independently clear secretions despite receiving instruction in the bronchopulmonary hygiene techniques of positioning, percussion, shaking, and vibration. Okay. So we have a patient who was in a mechanical ventilation, okay, for some time. And, many of those patients, when they are on mechanical ventilation, they build up secretions. And since this patient have muscular dystrophy, and for sure there is a muscle weakness, so the patient in our clinical vignette here is unable to get these secretions out. So we try to implement some airway clearance technique in form of positioning, percussion, shaking, and vibration. However, is not completely working for this patient. So the question here asking you about the next step. Which of the following interventions is most appropriate to help this patient clear the secretions? Number one, nasotracheal suctioning, manual costophrenic assist, supplemental oxygen, inspiratory muscle training. And we teach these techniques in the cardiopulmonary section. So if you are not aware of these techniques, please go back and try to Google them or search and read briefly about these techniques. But what is the correct option or what is the safest option for this patient? Okay. So any patient who is weaned from mechanical ventilation, because it has to be a gradual process. So the patient just being removed from mechanical ventilation 1 day ago. Okay, so the correct answer is number two, manual costophrenic assist. Okay, some people they will say, okay, why you didn't select a section? Okay, section is important, but I will explain here why we didn't select section. This is a manual costophrenic assist is a manual assisted coughing technique. Okay, so patient with muscular dystrophy, they have weak expiratory muscles and ineffective cough mechanism. After extubation, after they have been on a ventilation and they have a tube and so on. And cough mechanism is not working for every patient. We have other patients who would have a problem with this technique, like a spinal cord injury patient with amyotrophic lateral sclerosis, and other patients as well. So when we are trying to clear these secretions and maintaining bronchopulmonary hygiene, implementing different techniques like positioning. We are trying to move the patient as early as we can. So early mobilization is very important. Positioning, this pulmonary situation and breathing is completely different in supine lying position, from sitting position, from standing position is completely different. Okay, percussion, shaking, vibration, these are all techniques for mobilization of secretions and clearance of these secretions, getting them out. Okay. So we are trying to teach the patient, coach the patient for proper coughing technique. Okay, especially we will ask the patient to try coughing, and if it doesn't work, we need to teach the patient. Okay, why? Because we need augmentation of expiratory flow so these secretions can be expelled out. Okay. Otherwise, there will be pneumonia, there will be other situations, other complications. Okay. So the correct intervention here is a manual assisted cough or abdominal or costophrenic assist. This technique will increase the intrathoracic pressure when during expiration phase, and amplifies also the cough technique or the cough flow. Okay, it is non-invasive like suction, so that's why we have selected this technique, and can be done at bedside. And usually it is a first line of intervention for those people with neuromuscular disorder if they have ineffective coughing technique. Okay, so mechanical assisted coughing device, or which would assist this coughing technique, is also another option. Okay, but here this is the correct answer. Let's look at the incorrect options. Number one, nasotracheal suction. Yes, we will try this later on. If everything is failing, we have to do it. So, but it is not the first choice. Why? Because it is invasive technique, and it is usually uncomfortable for the patient, can induce some hypoxia, trauma to the airways. So we know that suction is effective in clearing secretion, but we are, placing that as a last resort or the last option. Okay. So non-invasive airway clearance technique will be tried first, manual assisting, mechanical cough assist, and if these techniques fail and the patient cannot protect the airways, has a lot of secretions which cannot be expelled, and we see a deterioration of the patient case, the patient is trying to develop more secretions, pneumonia, fever, some abnormal signs and symptoms, then we will try, sectioning. Okay, not every patient can tolerate section, and this is the problem, and that's why it is not our first choice. Option number three, supplemental oxygen. Oxygen will improve oxygenation, okay, but it has nothing to do with removing secretion or improving coughing strength or something like that. So it is not the best option. In respiratory muscle training, this is from the name, you can imply that we are trying to improve oxygenation as well, but it is, this technique will take some time. So it is a long-term rehabilitation strategy and will not actually be effective in immediate secretion of clearance after extubation or and removing of the tubes, like in our patient. So it is not the appropriate management for an acute case, like in our patient who just been weaned off a ventilator 1 day ago. Okay. So to summarize, nasotracheal sectioning, viable option to clear patient secretions? Yes, but it is a last resort. Okay. And we explained why that. Manual costophrenic assist, if does not work, then we will go to suction, but it is the first choice which we will try here. So patients who were on mechanical ventilation, as I told you, will develop respiratory muscle deconditioning, and this neuromuscular disease, which they have with the respiratory muscle weakness, will be further deteriorated. The situation will be further deteriorated. Okay, so manual assist at the lower ribs during coughing will assist the patient in clearing secretions and potentiate the coughing mechanism. Supplemental oxygen will not do anything for improving ventilatory muscle endurance. Okay. Yes, we know that it will improve oxygenation, but it will not be, help coughing here. Respiratory muscle training might be beneficial for this patient, but it is not, the best option after the removal of ventilation. And it takes time to also improve and train these respiratory muscle. So yes, we can start that, but it will take time. This was the answer for today's question. If you would like to join my BT license uh, preparation course, please send me a message on these WhatsApp numbers: 001 442 248 7206 or 0020 102 774 3702, and I will send you the details for the course. If you would like also to apply and join the post-professional DBT program, which is an online program at University of Montana in United States, which is at a discounted rate for some countries. Please also drop me a message and I will send you the details. I'm sorry that I am receiving sometimes irrelevant inquiries and people, who are going through applications, other issues, and I don't have time for that. So I have to be clear, and honest with you. I would like to help, but I don't have time to help everybody through these different steps, which would take time, will take effort, and usually it cannot be resolved by just simply sending messages on WhatsApp, or it is a professional work which will need time and effort. So if you need help with that, I don't mind doing it, for fee, but I will not be able to help on these personal issues or this personal stuff, for everyone. Sometimes I get several messages during the day from different people, and unfortunately, I cannot help with that. I have limited time and limited capabilities to do my own work and my own duties. Thanks so much for watching me. Please encourage your colleagues to join my channel and subscribe, and see you shortly and in a new content. Thank you.